Hello everybody and welcome back to my channel. I am Dr. Sarthak Kaushik and I am back again with another video. And I know I say this in every video that I'm making this video after a very long time, but it is what it is. So finally I have tried to get out some time and make these videos once again because I feel like it is something which I should keep on doing just to pass my time and help you guys in the process as well. So this video is going to be basically about all the upcoming first year residents who are going to join pediatrics, and these tips are going to be very beneficial for you because I think somehow I like picked up all the positives and the negatives, and I'm trying to tell you in this one place so that you know what you should be expecting and how realistic your expectation should be before you start your course. Because if you go in there with all guns blazing without knowing what to expect, you might be having some sort of difficulties navigating your entire year. So I think it's a video which should help you a lot, so let's just get into it. So the basic gist of pediatrics is that you will be seeing kids, which is pretty obvious, but I'm going to break this entire video into 5 things which you should know. Okay, so the first thing is that children cry a lot, and seems pretty obvious from the looks of it, which it is, to be honest. But you need to be accustomed to that constant noise, because as a first year you will be omnipresent, like in the ward, in the OPDs. So you'll be doing cannulations, you'll be doing procedures, or even in the OPD when you are seeing those kids, they will be crying a lot. And my entire point of telling you this is that sometimes there would be days where you won't be able to console them. They won't stop crying. Maybe they are in pain, maybe they are just throwing tantrums. But the thing I want you to know is that after a certain point, when you are so overworked, that it gets irritating beyond point. It starts to annoy you, it starts to get the better of you, and at that point of time you start to become like frustrated with all of this. You become irritated, you like start to hate children at that point of time. But in that process you forget what you're actually doing. And I've noticed that whenever I was feeling like this feeling, which you can't escape, but I think it's better if you knew that this could happen to you. Because when you're doing such things, and when the crying and the fussing is just irritating you beyond a point, you will not be able to do your work properly. When you're trying to put a cannula in a child that is already crying, and when you failed 4 to 5 times, the crying child and the failure of not putting a cannula is going to irritate you so much that you will never be able to put that cannula even if the child is in shock. So this is very important to know, and it does get better and better as you move ahead. You will slowly learn how to build a rapport with a child, and these are one of the basic challenges that you're going to face in the initial few months of your residency. So I think it is something which you should definitely expect. Okay, so the second thing is that learning the basics is tough. So in most institutes, the norm is that the first year residents will do the groundwork, and which is important for any functioning department. But the difference in peds from other departments is that you need to be very thorough with your basics, and that basics includes your clinical knowledge as well as your basic skills before you start getting into the management part of things, which you must be thinking what PG is all about. But that is not entirely true. So like if you think about it, like the first step of treating a patient is like securing an IV line. But however basic it may seem, securing an IV line in a child is a tough job. So it can take extremely long sometimes to do that. And it's a skill actually that you will learn slowly and slowly. But I'm just giving you an example. Similarly, you can't just get to treat the patients from the get-go, because the physiology is different, and the patient is not telling you the symptoms. It is what the parents perceive the symptoms to be. So at that point of time, the examination is very important. Understanding the subtle signs of a child and all of that is very important before we get into it. So my point of telling you that is that you need to be a little patient. Don't compare yourself with people from other departments, because they will be doing all of that stuff pretty earlier than you would do that stuff. But it's not a competition. So this is one another thing which you should realize. The third thing is that it's a high risk and a high reward job. So most people, when you talk to them, they will always talk about the high risk involved in pediatrics, because everyone is a lot sensitive when it comes to children, right? Whether it be doctors or relatives. And sometimes when you lose a patient, it can be a heavy toll on your mind because of obvious reasons. And I think it's just one half of the picture which others sometimes fail to see, and sometimes even you might fail to see. But it is important for you to see that you will get extremely happy when you see a child being, a sick child being treated and then going home with a smile on their face. So you will never be able to forget that. And trust me, there is no more satisfying job in the world like than seeing a child go home. Sometimes they'll come to you, they'll hug you, they'll click pictures with you. Sometimes some kids are so innocent, they'll give you chocolates and toffees also as they go home. But that's just the beauty of it. So I think it is a tale of two halves. And you as a pediatrician need to realize that you should be more focused on the better half, because this is actually going to help you to work harder. It'll help you like work better in a way, because you know what you are working for, you know. So I think this is an expectation which you should have from the branch, and move on ahead from that point. Okay, so the fourth thing is that communication is king. So now you won't be talking to your patients as much as people from other department must be, but you would be talking to the parents, to the relatives, history taking, to understanding the illness of the child, to prognostication, to counseling. Everything you'll be doing with the parents or the guardians or the relatives, whoever might be there. And this plays a very important role in the lives of a pediatrician, because see, you will be expected to be good and precise in asking history, because parents don't know like what's happening to the child. They're very anxious, and similarly, they'll constantly keep on asking you what's wrong with the child, what's wrong with the child, is he going to be all right, is he going to be all right. So these questions and all. And the thing today that is very important is that parents are equally educated these days. And even in government hospitals, parents are so educated because they have easy access to the internet, and they will come up to you with all sorts of questions. They'll be coming from various other places seeking treatment of their own, and they'll come and ask you things which you would have not have even imagined. But this is true. So it's very important that at this, like, you be gentle, professional, and empathetic with your words, because it's very important. And even breaking the news of a child's death is extremely difficult because of obvious reasons. But all of this can be done in like a smooth and a better way only if your communication is on point from the beginning. If you're good with your words, if you're good in communicating with the parents, the relatives, then you can prevent a lot of these negative reactions from the parents. Not all of them, but you can try to prevent most of them. You can try to be empathetic, but most important is that you have to be professional. And this is, I think, in my opinion, the most important skill that you need to learn as a pediatrician, so that you can work well with the community. And the last thing is that being vigilant is a skill. See, now you need to understand that when you move from your first year to your second year, you would think that your life has become easier. You'll be able to throw your responsibilities to your juniors and move on. And this might be true for a lot of other departments, a lot of other branches. But here you'll always be on your toes, because the responsibility sort of increases as you move ahead. And in most good institutes, you will always find that everybody, from the junior most person to the senior most person, is involved in patient care as much like, and everyone plays an equal role in that. Obviously the first year is burdened with a lot of groundwork, so life is going to be hectic. And that's what happens when you choose to be a doctor, especially in a country like India. And when you're working in a government hospital, it gets even more difficult. But if you're clear on what you want from this branch, if you're clear why you've chosen this branch, you will love the beauty of it. And I think it's a very good branch. It has a lot of positives. it has a negatives also, but I don't think any branch has just positives. Just like everything, there's a good and there's bad in all the things, and I think you should be ready for what's to come. It's going to be one hell of a journey. First year is going to be tough, and I'll soon be making a video on how you should go about dealing with all of that stress and all of those toxic seniors in your first year of residency. And I'll share some of my own tips which helped me sail through my first year. And I think it's going to help you, just as I think this video is going to help you, because all of this worked for me. I understood these things by myself. I understood these things because I saw my seniors do it. So when you're clear with your expectations, you will never be disappointed. So just stay happy and enjoy your first year of residency. It's going to be a good journey. And if you have any doubts, if you have any problems, you can always reach out to me on my Instagram channel, which is at the doctoring with Sarthak. And please feel free to tell me in the comment section below how you liked this video and what are your main concerns about joining a pediatrics residency. So till then, take care, bye bye, and all the best for your life ahead.